Dr. Singh, why are dental implants widely considered to be the most significant advancement in dentistry in the last 50 years?
It is very significant because prior to the invention of implants, implantology, we had no way of placing a root structure back into an area where a tooth was lost. So essentially we had to bridge the gap between two adjacent teeth, or place a denture, which would be basically a gum or supported appliance that would sit on the gum tissue, and that of course was unstable and was not a very good solution, but those were the only options we had. We had no way of anchoring it within the bone. With the advent of an implant, it's essentially an artificial root that's placed into the bone and provides the anchorage for whatever we'd like to build on top of it.
Dr. Singh, why is having a root structure important?
Well, having a root structure gives us the absolute most natural solution. It basically mimics a root, so by building an ideal crown on top of it, for example, you can't tell that there's something artificial underneath there. There's just an artificial root that you actually never see because it's embedded within the bone. So the patient gets the most natural solution for that, for replacing that tooth that we can get. Bridges, etc., for example, would go across the gap. Upon very close inspection, they wouldn't be natural looking, and for example, you couldn't floss between around a bridge, etc. You'd have to, if you had a bridge, you'd have to do many unusual things like threading floss underneath and stuff. Made it much more difficult to maintain, and it wasn't a very easy solution for the patient. With an implant and a crown, for example, it's completely natural. It's as though you never lost a tooth. It's the best solution we could have come up with.